Hello and welcome to Focus 54, your weekly guide to African news. I am your host, Yvonne Mokondani. Now, on today's episode, we cast a spotlight on a captivating journey through the triumphs, challenges, and aspirations of Africa's healthcare landscape. We explore the remarkable strides made in legislation, frameworks, and milestones that have shaped Africa's fight against diseases. Two esteemed guests, a public health symposium, Mr Retlaw Matorwa, and an international relations expert, Mr Manjonjo, will be joining us in the second segment. Now, together, we will unravel the complexities, discuss key alliances, and shed light on Africa's potential to become a global leader in natural remedies. But first, let's take a look at the stories that have been making headlines across the continent. In Zimbabwe, on the 21st of February, Zimbabwe commemorates the National Youth Day, a day set aside to celebrate the contribution of the youth dividend to the development of the country. In his address, Zimbabwe's president, His Excellency Comrade Emmerson Mnangagwa, says government will continue to deliberate policies and decisions for young people to participate in the country's socio-economic activities as well as governance system. Now, United Nations on Congo, the United Nations has warned that the humanitarian situation in the restive eastern region of the Democratic Republic of Congo has worsened, including gender-based violence. We move to Nigeria, where Nigerians are facing one of the worst economic crises in West Africa in years, triggered by rising inflation rate following monetary policies that have dipped the local currency to an all-time low against the US dollar, provoking anger and protests across the country. Now, the latest government figures released on Thursday show that inflation rate in January rose to 29.9%, its highest since 1996, mainly driven by food and non-alcoholic beverages. Thank you for watching Focus 54. This has been the first segment of the program, and if you were tuned in today, we're looking at how Africa is positioning itself in as far as becoming a global leader in natural remedies is concerned. We'll take a short break to join us when we return. Hello and welcome to the second segment of Focus 54. I am Yvonne Mokondani. Now, just catching up from where we left from, Rainlaw, I just want to find out, let's look at medieval diseases in Africa. You know, despite the various scientific advancements that we have had, diseases like malaria continue to be a problem now and again. What do you think that is the case?
In Africa, generally, we have a problem of weak systems.
Okay.
These weak systems, their inability to respond to outbreaks, for example, is also a cause of concern.
Mm-hmm.
We are also confronted with climate and environment issues.
Mm-hmm.
Climate change, for example, continues exposing us to such diseases. You will notice that we also have issues to do with inadequate infrastructure that responds to our health systems needs. Overall, my opinion would be that there isn't much research that is being done in Africa in terms of how do we deal with perennial outbreaks of malaria and cholera, for example. You'll find out that in Europe, malaria, they eradicated malaria as early as 1970s using DDT. But we
What's
can't
DDT?
DDT, these are is an insecticide.
Okay.
That they used in Europe when they were confronted with the outbreak of malaria in 1970s.
Mm.
But we can't use that anymore because of environmental concerns that has come.
Mm-hmm.
So basically, our failure to do adequate research and really concentrate on how best do we resolve outbreaks of such diseases is an issue of concern. We also do not have adequate data. Data is very important because it helps us plan, it helps us know the kind of diseases we are dealing with, the trends, when are we more vulnerable to these diseases. So that absence of adequate data will cause us not to act effectively In Africa, we are also confronted with the issue of rapid urbanization. Everyone is coming into the city, and our cities are not designed well to cater for the masses that are coming to the cities in terms of water reticulation system, in terms of sewer systems. So we need to strengthen our infrastructure to ensure that we provide better infrastructure for our people. Issues to do with access to water. In terms of African Union, less than 10% of Africans have access to clean water. So what does that mean? It means that our population is at risk. So we need to look at these issues from a holistic point of view so that we proffer solutions that are sustainable.
Now, talking about solutions, he mentioned the reasons why we keep on battling with such diseases as malaria now and again, to what he says are weak systems and everything else that he has mentioned. Let's look at it from a perspective where we have all these legal frameworks and policies that we've put in place as Africa to try and deal with these issues. What are those that have been maybe worked on over the past decade to deal with such diseases and hopefully put us in a better place?
Thank you for that question, Yvonne. Looking at the legal frameworks that have been done so far to curb the issue to do with these medieval diseases, I'll give an example. There is an MOU between South Africa, Swaziland, and Mozambique, where they have manned the Lobombo border, where they say they are immigrants from South Africa, either of the countries. They have to pass through a certain point where they have to be checked for these diseases. We also have to check at even within our region in the Southern Africa. You can't get into Mozambique, you can't get into Tanzania without a malaria vaccination card. It means those are some of the legislations that are being put in place so that we curb the spread of malaria within the region.
And it's not just malaria. I'm sure a lot of, I'm not sure whether yellow fever falls into this category of what we're talking about, but just looking at vaccinations and what is talked about, do you think people understand? Because maybe I want to travel to Angola and I need a vaccination card. Instead of me actually getting the vaccine, I'll just find somebody to pay and get a vaccination card. Do people understand how important it is and just basically taking care of their health? Because you're doing this for your own safety and for the person who's next to you.
I'll respond to that for a bit, then I'll give it to him. I think the main problem that we have, which is also causing to the continuation of this disease without ending, is because our people are not really educated as to why and how these problems should be ended. We have people who go and buy vaccination cards, then they travel. Then that means they're exposing the other people to the disease which they are not supposed to be exposed to. So I think we really need to educate our people, especially those who travel. Also, we need to have strong security systems that control our people when they travel so that they don't continue to expose other people to these diseases.
I concur with his opinion, but also let's look at it in terms of access. When we are talking about access to healthcare, we are also talking about access in terms of issues to do also with vaccine. Let's put yellow fever vaccination, for example. How much does it cost to get a yellow fever vaccination? Where can you access it here in Zimbabwe? I'm a frequent traveler myself. There are places I know if I want to get vaccinated, I go to this X place. But the cost itself is inhibitive, number one. Number two, we come from a negative policing aspect where we say, you can't enter Mozambique, for example, or Zambia without a yellow fever vaccination. But that is the approach we need to move on from. Let's educate our people through enough health promotion information to say, what are the dangers of not getting vaccinated, for example. Let's also ensure that these vaccinations are affordable to the masses who travel. There is no one who wants to put himself at a risk of infection. So we need to also look at those issues to ensure that we enhance access to vaccine. And when we are also talking about issues to do with vaccine, there's a lot of vaccine hesitance because of disinformation. So we also need to be on the forefront in Africa to really talk about issues to do with vaccination. The other reason why you find that Africans are so skeptical when it comes to vaccination. We also need to start promoting our own scientists to produce these vaccinations, because it is also not fair that every vaccination that we need comes from the US or comes from China.
And we cannot seem to do it on
We
our
can-
own.
Yeah, but this is something that is very doable. I'm with the Harare Institute of Public Health. I work with scientists like the Dr. Marumes of this world who can produce some of these vaccines. So we need to localize so that our people trust things that are also local. Yeah.
Right, you're watching Focus 54. Get vaccinated. It is for your own safety, and you know it is good. If you are a scientist and you think you have ideas that can help us innovate and be in a better place in as far as coming up with vaccines, please just do work with the relevant authorities and help us for the safety of the public. We take a short break. Join us when we return. You are still watching Focus 54, a very interesting conversation that we were having before we went for the break, the issue to do with vaccinations and whether or not people understand how important it is for them. And we're coming from a place where, as a world, we're battling with COVID-19. Let's narrow it down to Africa. How did we deal with it, and what lessons can you say we've probably learned from COVID-19?
One of the critical lessons we learned from COVID-19 is that everyone can be vulnerable. It's this disease which even affected from the rich to the poor.
Yeah.
But from a public health point of view, I think COVID exposed the weaknesses within our public health systems, not only in Zimbabwe, but generally in Africa. And it also opened our eyes in terms of redefining the field of public health, exactly to say, what is it? We were used to defining public health from a classical medical point of view, where we are saying doctors and medical scientists are the only ones who are relevant in public health. When we experienced COVID, we realized that YV is very important as a media person to do health promotion. I also need a statistician to maybe do disease surveillance and modeling. It is important to the community level to initiate community health initiatives where everyone take place. But above all, COVID showed us that as Africans, we need to interrogate our health financing models. We need sustainable health financing models that strengthens our health systems. Without coming up with these sustainable finance models, Africa is going to remain a beggar, and our health systems is going to collapse because we are looking for handouts.
But I know maybe you can say that coming from a place like we were talking about vaccines earlier on, from a place where we can say, okay, fine, we got vaccines from such a country and such a country. I don't have the stats to how many people died in Africa or how many people died in Europe. But generally speaking, you would be of the notion that, oh, maybe Africa was better placed in terms of deaths when it comes to COVID-19. Does that then not reflect something positive about a public health system?
Right. The way I can answer IV is that I was talking about data earlier on. The predictions that were done by Melinda and Bill Gates Foundation, for example, because they were using tools that were not relevant or context specific to Africa, their assumptions or their forecast was wrong, because in Africa we didn't experience as much death like what happened in Europe. However, one death or two deaths is too many, right? What I can really say is that during COVID-19, one of them, we have a robust traditional or alternative medicine system. We were eating the gingers, we're eating a lot of African herbs. We need Zumbani, yes. So we need to start ensuring that we mainstream also our African herbs, our African alternative medicines into contemporary health systems. So we also, what I was also happy about during COVID-19 is the responses from our government and the African Union itself. Although we were underfunded as a continent, but there was this swift movement to place COVID on the agenda And also there was a lot of health promotion work that that happened in Africa. Despite disinformation about the origins of COVID and where it came from, we managed to sail through.
So Vusi, let's look at disease burdens and improving public health outcomes. What initiatives have African countries implemented to alleviate what we've just talked about?
African countries, most of them have tried to improve their health systems through collaboration. We'll look at the Abuja Declaration of 2001, where all countries in Africa, they agreed that we need to put at least 15% of our total budget towards the health sector. Had we done that since then, I'm sure that by now we would have reduced the number of diseases and the prevalence of these diseases to which are destroying our people. Based on the Abuja Declaration, you see that the prevalence of malaria, even in South Africa, reduced by now. And the last case of malaria in, for example, Egypt, was last year in 2014. And even in Zimbabwe, malaria is reduced. So my issue is on had all African nations come together, collaborate, and still promote the Abuja Declaration, where a part of the budget, a huge chunk of the budget for our monies is put towards the health sector, who would definitely reduce the prevalence of these diseases.
Now he talks about collaborations and how they can help us as a continent to fight disease burdens and whatever, and you know, improving public health outcomes. Let's look at the significance of alliances such as the MOU on medicine regulations and manufacturing between Egypt and Zimbabwe in the context of Africa's, you know, willingness to become a leader in as far as natural remedies are concerned.
Okay, thank you, Wifey. This is a very progressive initiative in finding Africa collaboration. And when you are looking at that MOU, when I was going through it, it talks about issues to do with enhancing access to pharmaceutical drugs and also ensuring that we localize manufacturing of drugs. When you localize manufacturing of drugs, it will cut the cost of production. It will also enhance issues to do with research because you are promoting your local scientists. It will also brings in foreign currency. It will also open opportunities for employment. But above all, that particular MOU is quite interesting because you find Egyptians who are on the forefront of also using traditional medicine, for example. They've been very successful at that. That they are looking at Zimbabwe, for example, committing resources for us to do research on our herbal products and how we can do value addition, turn them into acceptable pharmaceutical products. And by the way, we've got a lot of herbal products with very significant matter in them. So when I look at this MOU between Egypt and Zimbabwe, it has potential to change the pharmaceutical landscape in Zimbabwe.
Now, talking about that, we once had a discussion which was more or less the same as the one we're having now, and looking at traditional medicine and how best we can use it for our benefit. And I want to find out, are we not our own enemies, or maybe are we just careful? Looking at the Medicines Control Authority of Zimbabwe, the registration of medicines, what needs to be done in order for one to actually register a natural remedy, a herb. Maybe I know this to cure flu or maybe control hypertension, but what are the stages that I actually need to go through to the point where my herb or whatever it is licensed?
YV, your question is very interesting because it will take us back to the power of colonialism, where we were made to believe that anything African without the blessing of Europeans, it's not accepted worldwide. You'll be interested to know that Herbex, a very renowned
I know that one, especially because
pharmaceutical
I'm
product.
female. Herbex is the one, the weight loss?
Weight loss. Originated from Botswana, and You also find rooibos, the one which we eat, we drink. So what we need to do, I think MCAS, Medicine Control Authority of Zimbabwe, I think he has heard the calls of traditional medicine practitioners and looked at a way of shortening the processing and acceptability of herbal medicines. Now, if you want to do herbal analysis, you can approach them, and it's easier now than taking 5 years. There's also a movement in within SADC, which stipulates that any herbal product that has been in use by Africans for 50 years going back must be accepted and registered is a pharmaceutical product, right? There's actually that movement going on at regional level. But in terms of how you register and get patents for herbal medicine to become acceptable, that is a very long process. That
it is a very long process, and I think I would actually need to invite you back so that we talk about it, for the interest of time. What I want to find out from you, Vusi, is the challenges and maybe what it means for us in our pursuit of becoming global leaders in as far as natural remedies are concerned. What are the challenges? What are the advantages? What does it mean for us as Africa?
Like what my brother has alluded, the first challenge that we are going to face is we self-hate. Anything that is African, we take time to accept it until someone comes in and says, this is it. That's the first challenge that we have. The other challenge that we have is we have multinational pharmaceutical industries who are making big money out of selling pharmaceutical products. So it would take time for them to give access to Africans to say, okay, this Zumbani can actually deal with COVID-19. Exactly. It takes them so that they accept our medicinal products. But in the case that we start appreciating things which are African, we have everything that we need in Africa. We have the flora that we need so that we produce the medicinal products that we want. But another challenge that we have is that we didn't document these remedies and these products from back then. Some information and some knowledge has gone down. People have died with it. So we need to start documenting these things. We now need to start recording these things. Also, partner big multinational pharmaceutical industries so that they fund the research and also partner with us in terms of developing our products, marketing them, and making sure that the standards are approved for the international market.
Now, talking about the international market, let's look at international relations and how it can come in and help in facilitating technology transfer in just a bit. For the purposes of time, we're running out of time, unfortunately.
International relations will come in the place where we need to make MOUs with other countries which are better, and these starts from locally. We have South Africa, which is better in terms of medicinal products are concerned. We have Egypt, so we need to start locally. We collaborate with our own countries within Africa before we go beyond.
Yeah. Retlaw, I know this will seem like I'm being unfair on you, but time is always an enemy. But hopefully we can continue with this very important conversation at another time.
Thank you.
Thank you for coming. Focus 54 on SABC News. Thank you for having joined us.